Hi, I'm Dr. John Willardsen, trustimplants.com. So today I'd like to speak to those patients who have had the all-on-4 procedure, and they've been, they've taken the initiative and they've gone and had the treatment done, but now they're having complications or problems. It's very common that we see this in our practice, that patients come from some of these other large all-on-4 centers, that's all they do is all-on-4, and they've spent their money, and now all of a sudden they are having to fix it, repair it, redo it. And so let's talk about why that is. So if we take a look at this image here, this is an x-ray of an all-on-6 versus an all-on-4, and you'll notice and it's a little hard to to see this image, but you can see how all of the implants are concentrated in the front of the jaw in the all-on-4 situation versus the all-on-6, where we distribute the implants evenly and get you support in the back of the jaw so that the entire prosthesis is supported by implants. There's no cantilevers. We don't have to cantilever off the back side 15 millimeters or something. And by doing that, we're able to give a much more aesthetically pleasing and stable platform for this bridge to sit on, okay? And so if we look at, so that's the image, and that's about the best way that I can show and describe really what's going on with the all-on-4 procedure. And so here are some cases where, and I see 1 or 2 a week, patients who've come in, they've had the procedure done, and the prosthesis is failing or implants are failing. And so, and this, as you can see here, she spent a lot of money having this work done, and now a few years down the road, here we are having to redo everything. Or we've got situations where, because of these extreme cantilevers or implants in random weird positions or weird angles, we get screws that fracture off or break inside the implant. Fortunately, I have the tools to get those broken screws out, but we're talking, this implant is probably a 4.0 millimeter implant. The screw itself is probably maybe 2 millimeters at the most, 1.5 millimeters, and it's buried way down deep in the implant. This screw is actually, I've already backed it out, but it was way down in there in the implant, and so it took me about 2.5 hours to get this screw out in order to salvage the implant, because if I can't get that screw out, now that implant is useless. We have to take it out. And so only reason I bring that up is because biomechanically it's a very unfavorable, these angled implants, angled abutments, and these situations where we can't change the fact that the patient is biting down and putting 450 pounds per square inch in their mouth every time they bite down, and trying to ask for implants to carry that much of a load with extremely angled implants on these tiny little multi-unit abutments is a tall order. And as a result, we see a lot of failing all-on-4 cases. Here's another one. She went through the entire process, had the implants done and the prosthesis made, and then about a year later, here she is, chronically fracturing and failing prosthesis. They had tried to repair this like 4 times already, and finally she just says, forget it, I'm going to try to go somewhere else and have this repaired elsewhere. And so, of course, I can't use this bridge at all. I have to start over, and I had to add additional implants in order to give that support in the back of the jaw so that that cantilever isn't so extreme. Another case went through the process, had all of this work done, and just catastrophic failure. Everything is breaking, the abutments are all breaking, the implants are failing, and the teeth, of course, are long gone. He even broke the titanium framework that's underneath all of this. So again, we cannot change how his bite forces or his masseter muscles, the amount of force that he puts on that bridge. I can't change that. All I can do is build into it a bridge and a prosthesis and a situation that can handle that much load. And to put every single patient into an all-on-4, you end up with these situations because the all-on-4 cannot handle that much load. And so, and I think it's a real disservice that we've got all-on-4 implant centers popping up on every corner and not really thinking about what are we doing to these patients. Is this the most ideal treatment for this person? And just putting every patient in an all-on-4. If I were to go to one of these big box implant centers and say, I just want you to work on me, they would say, okay, we're going to pull all your teeth out and we're going to put in 4 implants and put a screw-in denture in there, and then we're just going to cross our fingers that this is going to last you the rest of your life. Doesn't work like that. Take a look here. Look at the difference in materials. Now let's talk about the prosthesis itself, the bridge itself. And let's look at the difference in materials, because that's a whole nother factor that in reality, as a new patient, you're going into one of these, all-on-4 implant centers. They're not going to get into all of the nuances and the details of, what are the implants made of? What material are the implants made of? What type of titanium? What brand are they? I use a different implant in the lower jaw than I do in the upper jaw, and I treat it individually. I don't just go, okay, I only have this brand of implant, so I'm going to use that on every patient. And so, or this style of implant, I'd rather say. So, so take a look here. So notice this is a failed case, of course, and notice the discoloration, the materials used, and how dirty that is underneath there. This is as we took it off. One, because of the design. It's dished here. So how in the world can this patient clean underneath there and actually remove all the debris? They can't. And so every time I were to take this off, the tissue is very inflamed, it would bleed. And so materials are very important. So, and of course, at most of these implant centers, they will advertise, $30,000 or $40,000 for both arches. But you're not getting your money's worth in that, I can tell you, because you end up with so many complications. It's better to spend a little bit more, and I'm not talking a lot more, but a little bit more, get more implants and get a better designed and prosthesis with better materials, and then you don't have to deal with this again. So notice what we use here at Trust Implants. Take a look at these teeth, but more importantly, of course they look great, but let's look at the material. So here's the bridge that I had taken out of this patient. There's actually rust on this framework. So whatever material was used or cast, or usually it's titanium, but in this case I'm not sure exactly what it was. There's so many problems with this case. There's just the design of the bridge, of the metal framework underneath, and the denture teeth wrapped on top. It's just a recipe for disaster. But look at what we use. This is the area that adapts to the implant. So this piece here goes into the implant. And notice this beautiful zirconia that it pushes the debris away. It pushes the bacteria away. It pushes the plaque away. It does not adhere plaque. Anything like this situation, that not just the design of it and how it's concaved, and so food, debris, plaque, everything is going to harbor in here, and more importantly, harbor around the implants, that and implants don't like having that type of bacteria live there. The tissue, as I said, becomes inflamed, and ultimately we get what's called peri-implantitis, where the implant is like, okay, I'm out of here, bone pulls away, and then we have to extract the implant. And so, but just look at the difference in materials and design, not just even the sleeve that I use, and then the connection, how it's just, the design is so much better, and it's such a better investment to use materials that are going to last you for the rest of your life. So my advice is, if you are currently wearing an all-on-4, or you've had an all-on-4, or you're having issues with an all-on-4, give us a call so that we can help you get to a situation where, unfortunately, you've already kind of gone through this process, but there is hope. I have replaced thousands of all-on-4, or restored and fixed all-on-4 cases, literally thousands of them. And I have worked through all the nuances and the aspects of it that I really don't agree with, and never really did, even from the beginning. When I first saw this procedure come out way back in the early 2000s, I was scratching my head going, what is going on here? And now it is marketing has just put it out there everywhere. And you have full implant centers that is all they do is all-on-4, that they don't even offer anything else. So anyways, my advice, make sure you find a qualified surgeon and restorative doctor or prosthodontist to restore this case, as well as what type of materials are being used, what type of implants. I would not use anything other than a zirconia prosthesis. In my practice, we don't use any metal prosthetics. It's all zirconia. And as a result, we have no problems, 0 problems whatsoever. I'm Dr. Willardsen. Thanks for watching, and visit trustimplants.com.